Thank you everybody for joining and welcome. We have some beautiful people who will be sharing their expertise tonight. That's not including myself. I'm Jason Kahn. I'm Jason Kahn. I'm the head of communications for Chelsea Senior Living, and so happy that all of you are able to join us tonight, and all of you who are able to watch this recorded presentation as well, this webinar, which talks about really the intricacies of speech language pathology therapy that we provide and Fox Rehab provides at our communities. And I don't think we realize how many factors affect our speech and our language and our cognition and all of that. Obviously, as it relates to our senior residents, it's more so impactful. We know that as it relates to Parkinson's disease and dementia, those are things that we're familiar with where our speech and language are really affected. But what we don't realize sometimes are maybe seniors coming out of traumatic medical events where their speech and language are also affected. And listen, I know a lot of people, you do your research about speech and language and the different mechanisms that we currently hear as it relates to perhaps technology, AI, et cetera. What's the next generation? What's the next wave? But I think it all comes back to fundamentals, right? Back to the basics. And that's that one-on-one clinician experience that you just won't get anywhere else. And that's why we have these lovely two Fox Rehab experts on with us today. I'd like to introduce you to both of them. We have Anthony Ruggieri, who is the Director of Senior Living Partnerships with Fox Rehab. He'll introduce himself in just a second. And then we also have Chantal Perugini, who is a clinical specialist with Fox Rehab and has about like a dozen licenses and certifications, et cetera. So she knows what she's talking about, and she's going to be leading this presentation tonight. But I'm going to pass it along to Anthony to give himself a quick introduction here. Anthony, go ahead.
All right. Thanks, Jason. Yeah, I'm going to be short and sweet here. I'm not the expert on speech language pathology by any means. That's why we have Chantal here, who's going to walk you through kind of SLP 101. But I guess first, to open it up, this is our third webinar. Our last one was on dementia management. If you attended that, you know that cognition and speech really, play a big part in what we focus on when we're treating folks with dementia. Speech is a vital part of that. Fox partners with Chelsea Senior Living to provide a continuum of care that's effective for their residents, keeping them safe in the community. And speech therapy is one that might be overlooked. One of the disciplines, everybody knows physical therapy. Some people know occupational therapy. Speech therapy sometimes gets overlooked, but it is a vital aspect of the interdisciplinary care of Chelsea residents. And so we're proud to work with Chelsea. They have a like-minded approach when it comes to care. And I'm going to pass it on to Chantal now so she can fill you in on what speech therapy is, how it affects residents, and how it keeps them safe and aging in place.
Yeah, I'm turning my camera off because nobody wants to see me anymore. Trust me.
Thank you, Anthony, and thank you, Jason, both for having me here, and thank you to the Chelsea for partnering to set this up for us. Thank you to all of you for being here today. Your presence here is indicating that you yourself are interested in learning more about speech pathology, or you are interested in learning more about that for a loved one. My name, as I said, is Chantal Perugini. I am a speech language pathologist with about 15 plus years of experience. And like Jason had mentioned, I have a certified dementia practitioner certification, brain injury specialist that I achieved. But the majority of what I do comes from the experience of working with the older adult. And why I became a speech language pathologist was, we work with a variety of different populations, from pediatric all the way through end of life, living. But I love working with older adults in this population that are still motivated to participate in therapy. We as SLPs and we as therapists need to really dive into the functional pieces about what do you want to improve on. If there are some changes happening, there are a number of different things that we can look at as speech language pathologists, which we'll dive into a little bit deeper today. But what we really need to figure out is the root of what are the things that you love to do, and how do we keep you as independent as possible, and how do we keep you doing the things that you love to do as far as your hobbies, things that you enjoy. So that's why I personally became a speech pathologist working with older adults. And like Anthony was speaking about, many people know very well, what does an occupational therapist do? What does a physical therapist do? You can see it. You see them walking up the stairs. You see them walking down the hallway. You see them helping with getting dressed in the morning. Those are things that we tend to know right away. Speech language pathologists, on the other hand, sometimes when I'm making a call to a family member or speaking with a patient to say, hey, we have a referral for speech therapy, sometimes you may think, well, I'm speaking just fine. I'm not really sure why I was referred for speech therapy or speech language pathology services. And that's not outside the normal. But we do look at a number of different things within our scope that are not just related to speaking only, even though that is one of the major things that we work with. We can work on speech language, we can work on voice, we can work on cognition, and we also look at different things for feeding and swallowing. So I hope that helps in having you just dive a little bit further at some of the other things that SLPs can look at in addition to just language, as far as how you're speaking and how you're understanding communication. So today's topic is how to find your speech again. We are going to just briefly recap exactly what is a speech language pathologist. So we're a profession of highly skilled clinicians who have the knowledge and base to work closely in a variety of different settings. So as I mentioned, we sometimes will work with children that are learning language. Adults, on the other hand, have typically had something occur in their lives where they're now regaining and doing a rehab of speech. So that to me is one of the fascinating pieces and why I like to do what I do for this profession as well. We work to not just treat, but also we evaluate. We see what are the underlying problems. We'll talk about a number of different diagnoses that can lead to some speech disorders or cognitive disorders, voice disorders, that we'll talk a little bit more closely about tonight, and learn just a little bit more about how an SLP can help to target some of those different areas to improve function, and not just function, but also safety and quality of life for the older adult. One is to sort of kickstart things with highlighting that more celebrities have been coming out and speaking up about different deficits that maybe they've had with speech. Now, these are people who rely on their speech for their everyday profession. Recently, you may have seen in the news a beautiful actress named Tatum O'Neal. And if you don't know Tatum O'Neal, she actually was the youngest rather actress. She was 10 years old to receive an Academy Award for her role in Paper Moon. So she had been an actress for a very long time, using her speech for her profession, for what she loves to do. Unfortunately, this woman had endured a very severe stroke. So that's one of the things that can happen, one of the diagnoses that SLP can work with, which led to something that's called aphasia. And aphasia affects your ability to express and create words and phrases and sentences appropriately, communicating what you need day to day, as well as it can also affect the understanding or the comprehension of speech. So you may have seen some of her interviews and about how, she went through this very difficult time in her life where she came out of a coma and she had no words, is what she explained. And then she, stayed motivated. She worked with speech language pathologists, and now you can see on her interviews that she's made tremendous progress. And she said that she hopes that speaking out will help others with their own healing. So that's one of the reasons why we're here today, to let you know and to be informed that if you are starting to experience some changes, whether it be in communication, cognition, voice, swallowing, some of the things that we're going to talk about in further detail, please let's get those addressed right away. The sooner that you can start a plan of intervention, become assessed, talk with your SLP about some things that can work for you. Being involved just in even some way can sometimes help. Sometimes we have patients who are really motivated to do many exercises. They're all in. Other patients will tell us, hey, like, we're not really interested in doing a ton of exercises, but we have a place for them too. Maybe we have some certain strategies or recommendations for them and their family or their caregivers, just to communicate on the same page, or to be able to still eat their snacks, their meals that they love. So there's a number of different ways that we can be involved in the older adult's life. And I wanted to share with you a video that I actually created. I hit the streets of the community, and I asked some patients that I have had recently, how has speech therapy impacted their lives? So I'm going to shoot to that quick video clip to share with all of you. Hi, I'm Chantel Perugini, and I'm here in New Jersey Shore North 2, catching up with some people in the community to ask them how speech therapy has made an impact on their lives. Come on, let's go.
It helps me to speak with my grandkids and kids.
Oh, tremendous. Oh my gosh. Yes. It's wonderful. It's a gift.
Helps me keep my thoughts even.
It has me to eat safer.
It's good. Let's make them strong, you know?
And I love it because it makes me better.
I have the breath to play.
So thank you so much for watching that. Those were actually some of my patients and friends that agreed to have me interview them and share, as you could hear, many of the different ways that we've worked together for eating, for overall feeling better from what we've been working on to communicate with their family and their friends. The gentleman at the end, you can't forget about him. He said he has the breath to play. So some of you may not have even realized that we actually can work on breath support. And breath support is something that can help with your coordination of swallowing when you're eating, if you're having difficulties with your breath, as well as finding the right ways to increase your breath support for getting a louder voice. Oftentimes I may work with patients who are struggling with a diagnosis called Parkinson's, where it affects their vocal quality. They may or may not even be aware that their voice is not as loud as it used to be. And family members, whether they're within normal limits for hearing or possibly even have some hearing deficit, can be very detrimental to the communication system in the home. So just some little areas to be aware of, and was really happy that some of my patients had some fun creating that video with me. So just to go into a little bit further detail, I want to kind of just keep this as a summary of some of the things that we do. But I wanted you to be aware of some of the specific things that you can look for to see is this normal aging, or is this maybe something that's starting to change that maybe I might need to seek some services for. So language is something that is deficits that can be following, like we had mentioned, a stroke, as we call it, a CVA, diagnosis of dementia, any sort of cognitive changes can lead to language changes as well, and also traumatic brain injury. I had the ability to be able to sit through a certification course for this in February, and I learned a tremendous amount in addition to what I had already known about working with individuals who had some sort of brain trauma. And that can be as a result of services in the military. It can be a result of accidents. It can be a result of sports injuries. So many different types of patients can have traumatic brain injury, and or traumatic brain injury that leads to another type of diagnosis that we can be involved in. Speaking of celebrities, I think some of you may have also heard of Bruce Willis. He has dementia with also aphasia, and has been also seeking speech therapy. Him and his family have come forward saying, being more open about these types of diagnosis, and how when you get intervention, how it can make a huge difference in your day-to-day life and keep the value to things that you like to do. So working towards those goals with an SLP can really help you to communicate, and in turn do the things that you still love. Formation of speech, so following a stroke or brain injury, or even those early onsets of dementia, can make it difficult to sometimes create the different sentences or conversations that you want to share with your family and friends or caregivers. We had mentioned voice and the volume, getting the right amount of breath that you need to increase your vocal quality or your vocal loudness is something that we can work on and help with. Cognition. This is an area of service where I feel working with the patients as well as anybody that's involved in their day-to-day care or family members also makes a really big difference. So when we're typically working with the patient who has any sort of, whether it's very mild cognitive decline or severe cognitive decline, the best approach is really an interdisciplinary approach. And we had talked a little bit about how an SLP also works with PTs and OTs. And the interdisciplinary team effort really is so needed, especially with many of these diagnoses that we mentioned. Oftentimes, for patients to be successful with their physical therapy, with their occupational therapy goals, an SLP can help them to increase the safety, increase remembering to use certain adaptive equipment at an earlier time so it becomes more part of their routine, helping to maybe create some visual cues or reminders that they may need to be as safe as possible or follow through with home exercise programs that they may have. And last but not least, we cannot forget about our role as SLPs with swallowing. So many people hear speech therapy. They don't always think that we are the swallowing therapist, but we work with something that is a diagnosis called dysphagia oftentimes that leads to, could be issues orally, pharyngally as you're swallowing, or also esophagally. We may need to make consults for that. So if you're noticing any difficulty, we'll go into some details about that too, what you can look for if you're noticing some changes with your eating, noticing weight loss, or any changes with you or your loved one there. Some diagnoses that we commonly treat, we had mentioned stroke that can lead to aphasia or praxia or dysarthria, swallowing deficits that can be, like we said, orally chewing, moving the food, clearing the food from the mouth. Pharyngally is the swallow. Oftentimes the strength of the swallow may not be strong following one of these areas of deficits or following a surgery where possibly a patient was intubated and could have had some damage there. We as SLPs can work to strengthen, to increase the strength to protect the airway, decrease the amount of possible coughing or risk for aspiration where food or drink can go down the wrong way. Cognition is a huge area where I feel like I've been getting more and more patients that are coming forward, being honest, the patients and the family members being honest about some of those changes that they're starting to notice, instead of trying to cover them up and say everything's fine, I'm doing just fine. At the mild stages, it can be easy to kind of use your own compensatory strategies to kind of hide that from maybe family members or caregivers that are coming to see you on a day-to-day basis. But the more honest that you are, if you're starting to have some changes, your loved ones may not know that you're going through some of these small changes. If you're honest about, hey, I'm starting to have more difficulty, that's causing some frustrations for you, forgetting where you're putting things, forgetting the names. Maybe you're still driving, you go to the supermarket, you forget where you parked your car. These are all things that can be, small indicators that we're starting to have some memory loss. And why not get an assessment to see if there's something that we could do? Because remember, we're here to help you. We're not here to take things away. We're here to work with you and your families to keep you safe, give you some ideas, see what you're already doing, and see if we have some new ideas based off our experience, based off data and research that we've done to see if you can make these improvements. Some different types of diagnosis that are very common too with the practice, the setting that I work in, Parkinson's disease, like we had mentioned, dementia, but treatment goals are identified by an SLP and the support system that allows participation in meeting activities to optimize the individual's potential and outcomes. So just can't say this enough that it's a team effort to make progress. Oftentimes we need to have a very big support system. So whether that's with you or your family or at the senior living community or with your therapy team, we're going to get where we need to be, but oftentimes we need to really all work together. Wanted to kind of quickly go through what is normal aging versus what are some signs that maybe there's some mild cognitive decline. So normal aging, you're having, no problems with your conversation and so on. But looking at some mild cognitive impairment, things to look for could be frequently misplacing objects, repeating the same story, impaired recent memory. Oftentimes, our long-term memory will still be just fine, but we'll have difficulty remembering what we just did that morning, or maybe completing some tasks or remembering appointments. That's a big factor, like forgetting that you had possibly a doctor's appointment coming up. As far as language, could be word finding, difficulty following conversation or following directions too. That's really where sometimes I'll get referrals from the PT or the OT saying Mrs. Jones was having increased difficulty following what I was asking her to do. So how can we get involved? Executive function is something that we talk about because we can help people that are still very complex and high functioning. You may still be living in your home, or you're living in the senior living, and you're still responsible for doing things. We like to ask, are you still shopping? Are you still doing your laundry? Are you still paying bills? Do you like to travel? Do you have a pet that you take care of? All these things, if you're starting to make some small errors, you probably still want to keep doing those things, but how can you do it still effectively and safely? Clinical indicators to refer to speech therapy or consider speech therapy. Just a quick recap, we had already said swallowing includes coughing, weight loss, pocketing of food. Voice can be decreased volume or poor quality. Communication could be difficulty understanding or communicating, or even pronunciation. Don't forget about that articulation piece too. Oftentimes we have to do exercises to increase articulation is a big part of speech. That may be why they're a little bit unintelligible. Cognition can be also related to attention. Let's not forget, part of cognition is remaining attended to different activities or routines that you have to be doing. Difficulty with recalling things or important dates that you need to do. Also, problem solving, planning, and reasoning are areas that we assess and treat. We consider evidence-based approach. So there's a method to the things that we're going to be putting in place. Once we kind of figure out what the individual needs, we are going to put our thinking caps on and apply different data and research to strategies and goals that we can set for that individual's needs to get them to make progress. So that's what we mean by tracking objective measures. We have different standardized tests that we can see how are you progressing, and then what do we need to do to educate others to keep that progress going.
Oh, I'm hopping back on. I had a quick question, actually, if I can.
Yeah, sure. What's going on?
So my my grandmom has some cognitive deficits. She's getting therapy right now. My mom's taking care of her. She lives with my parents. It's a lot of burden on my mom, so she's trying to get all the help she can get. Do you have any suggestions for like compensatory strategies to for cognition? Like, is it reminders, like things that my mom can do, or anybody who's a caregiver can do to help them remember things? And I don't know, just real life example.
Yeah, of course. That's a very good, I'm glad you brought that up, because when it hits personally home for us, sometimes we don't even realize it as much, like how much help we can make a difference. So you said that she's sometimes having some trouble with remembering just small things she needs to do. And sometimes that leads to frustration or behavior. So what I like to say is set them up for success. One of the best strategies is to do something that we call errorless learning. So let's say she's following a morning routine and she forgets to wash her face or brush her teeth, or she starts to brush her teeth with no toothpaste. You can be like saying, how silly of me. I should have put that on for you. That's my fault. It kind of helps to decrease that, oh, well, I don't need any help and I didn't need to brush my teeth today kind of attitude. So set her up for success. Oftentimes when they're starting to have some difficulty remembering, they may ask the same question over and over again. Where are we going? Where are we going? Who's coming over? Who's coming over every minute? So instead of waiting for the question, try to anticipate their needs and just validate them and remind them everything's going to be okay. That's the validation part. And the reminiscence part too is just kind of saying, we're going to the doctor's today. We're going to the doctor's in about 5 minutes. Just keep getting ready. With me, we're going to be fine. We're going to the doctor, right? So kind of always doing that, setting them up for success strategy, visual cues. There's a number of things that we can do. Like we'll have to assess your loved one and figure out exactly what works for them. But Yeah, sometimes it's just a matter of small things that can go a long way, like even just the way that we're presenting questions, simple, direct eye contact with them makes a big difference. So
Yeah, I mean,
thank you
I
for your
always,
question. Yeah.
yeah, I always think of like PT gets somebody from point A to point B. OT, helps with the functional tasks once they're at point B. But if they don't know how to get from point A to point B or do the functional tasks or the steps necessary to complete ADLs, like there's no that's kind of the last piece of the puzzle. So my grandmom will get out of bed fine. Physically, she's okay to ambulate, walk to the bathroom. When she gets there, though, she says like, I don't know what I'm doing. I don't know what am I doing? What am I doing? And so there's some issues there where we have to give her reminders. But I'm sure if there are caregivers on the call or folks that have loved ones that are struggling with stuff similar to what my grandmom's going through, maybe I'm glad you were able to answer that question. I'm sure it
Yeah,
helped.
we're here for you, and we're here for your grandmom if she needs anything.
Yeah.
But yeah,
I know
actually
you
just
are.
pulled up.
Actually, my grandmom is using Fox, by the way. Just shameless
That's
plug there, but
amazing.
yeah, she
I
is.
hope she does so well with it. And I just pulled up
Yeah.
one of the final slides here because I thought it kind of tied into what your question was. So, targeting specific tasks that are meaningful to them, using those external memory aids like visual cues, reminders, big print for them. Space retrieval is something that we could do in therapy to kind of have them remember some things that they're working on. But errorless learning is that part that I really can't emphasize enough, like setting them up for success. Not questioning them so much, but more providing them with the information. And if she gets to the bathroom and she doesn't remember what to do, it's kind of like just naturally explaining it all the time. Even when you're feeding somebody who can't see, can't hear, always explaining. We're going to be having some macaroni and cheese now. Are you ready? Open your mouth. Here it comes. Just working through step by step really decreases any frustration behaviors. That's for people who are, having issues with the feeding and the cognition. Just very quickly, like some things to look for as far as swallowing goes, that could be difficulty is coughing, choking, weight loss. You don't want to have any dehydration or issues with that. But other than that, I wasn't sure if we had time for any success stories, but I'll just kind of leave them up here for you guys to read through if we're short on time.
And
Yeah, well,
yeah.
listen, we could probably, I know you could probably talk about this all day, Chantel, but as everybody can see, she is very passionate about this. I can't thank you enough for sharing, all that you have so far in just this short time span. I mean, you really packed it in and really were informative to everybody. I hope everybody felt like they were able to take away a lot from Chantel. As I put in the chat, everybody's microphones are now available to access. So if you click on the muted microphone, which I believe is in the top navigation menu there, if you click on that, it will unmute your microphone, and feel free to ask questions if you'd like, or you can enter them in the chat window. We'll also provide our email addresses in case you have questions, and then I'm going to follow up with a recording of this presentation after we are finished here this evening. So anybody else have a question to ask Chantel? I believe we have somebody who is currently
Yeah, if anybody is not having any questions, I want to thank you so much for joining today. It was a pleasure to be here. So thank you so much for having me. And then those that do have a question, feel free to even pop on camera. I'd love to see you, or just unmute your microphone. Oh, I think your microphones are unmuted, like they said now, or you have access to ask whatever's on your mind. I'm glad to see that people are finding this to be beneficial. That's what we're here for, and we're definitely here to help.
Yeah, so here's some key takeaways for me from what Chantel was talking about. You can confirm for me, Chantel, if I'm accurate or not, if I'm on the right path here.
Okay.
But speech and language, not just about speech, language, and cognition. It's also about breathing. You can obviously work on your breathing here. That was one key takeaway from me, but there are also 5 areas of focus as it relates to the help that you can provide for speech language therapy. That includes language, speech, voice, cognition, and swallowing. And one of the key takeaways, actually, out of all the takeaways here that I felt was really important that people should know, is that this is a team effort, as you pointed out, right? This is not on just one person. This is not, something that should feel cumbersome or feel like it should weigh on just one person. This is you, your support system, your clinician who's working with you. This is everybody. So it takes a team to make progress here. So that was one of the big key takeaways that I took away from all of this. And then as we just brought up here, you talked about errorless learning, which is something that is great. And I appreciate Anthony for asking that, because I think that that's really important, right? Is to provide reinforcements by reminders, and making them feel empowered rather than belittled. So those are my takeaways from today's presentation. I hope everybody else felt they were able to take away perhaps some other little golden nuggets from this presentation. But as I said, we will provide our information. We'll provide our contact details. Any last words from the both of you, Chantal and Anthony, before we leave everybody?
That was a wonderful recap. Thank you, Jason. Thanks for sort of summarizing a little bit about what we talked about, because it can be a lot of information. So I'm glad to hear that we can walk away with some pieces and hopefully start applying that or reaching out if we need the help. So.
Yeah, I think it's just there can never be enough resources, and when you're out there and you're taking care of your loved one, trying to figure out what is best to within the continuum of care to give them at any point in time. The more resources you have, the better. Obviously, you could always reach out to Jason if you have any questions about Chelsea Senior Living, any questions about Fox Rehabilitation. You can certainly reach out to me, myself, or Chantal, or anybody at our organization, and we'll be sure to point you in the right direction. So thanks for joining.
Thank you, Anthony, and thank you, Chantal. Thank you. I bow to you, Chantal, for your great presentation. It was fantastic today. And if you want to see some success stories from Fox Rehab, we have them squarely on our website. All you have to do is click on the resources tab by going to chelseaseniorliving.com, clicking on that resources tab, and clicking on success stories. And when you click on success stories, you're going to see amazing stories from residents across all of our communities. You'll actually have some videos there, and we're working on more video presentations. But one of the first success stories you'll see is a speech language success story at our Brookfield community. Very powerful stuff there. Love watching that video. I think you guys will enjoy that as well. And we'll send all this information out, including the PowerPoint, if you guys want to review it. Other than that, I hope everybody has a great night. Enjoy your evening, and we look forward to seeing you at our next webinar with Fox Rehab. See you, everybody.
Thanks, everyone.
Thank you. Take care, everyone.